Hello everyone, this is Dr. Shumaila Bassi, MBBS and MS Obs and Gynec, working as consultant gynecologist at Cloudnine Hospital, Ludhiana. Epilepsy means having fits. So if any women with epilepsy gets pregnant, then there are many complications and many side effects. The first one is she can have again fit in her pregnancy. She can have continuous fits and it is called status epilepticus, which is really very dangerous. She can gift her fetus many congenital malformations, or she can even die. Now, having epilepsy again in pregnancy, meaning having fits in pregnancy, is not that common. Mostly 2/3 of the females, they stay okay. Only 1/3 of the females who don't take their drugs properly, who have stress in pregnancy, who don't have well-wishers and family members to take care of her, or whose drugs are not prescribed properly, they might have fits. Other females may stay okay. Status epilepticus happens in those females in which polytherapy is given. Many drugs are given together, or the dosage of drugs is increased, or they suddenly stop their drugs, suddenly has any precipitating factor or somebody dying, any problem in the family member, or she is not able to sleep well. Status epilepticus happens when she recurrently has fits, or any fit it continues for half an hour or more. In such conditions, she should be taken to the hospital, and mostly the obstetrician will advise termination of pregnancy, whatever gestation she is in, and she will be admitted to an ICU. Now, regarding congenital malformations, there are many anti-epileptic drugs which lead to congenital malformations in the fetus if they are specially given in the first trimester. Drugs like sodium valproate, they are very common in gifting these malformations to the fetus. So if you're on sodium valproate before pregnancy and you get pregnant, consult your obstetrician or your psychiatrist to change this drug. Now, this drug should not be immediately changed, but should be tapered off and put on the other drugs. Monotherapy means taking only one anti-epileptic drug. So if you were on 4 or 3 drugs earlier, you should come down to 1 or 2 drugs after a discussion with your psychiatrist and obstetrician, and you should always take your drugs on time. Now, maternal mortality is very common, almost 10-fold increase in maternal mortality in pregnancy. Now, epilepsy can be managed very well. It is a multidisciplinary approach. That means not just the job of your obstetrician, but your neurophysician, your psychiatrist, along with your family members and friends, help to control epilepsy in pregnancy and bring down its effects. If it is controlled very well, it does not show any complications, and a pregnant female can safely deliver a healthy fetus, and she herself can stay fine. Having fits in the postpartum period is most common. So after your delivery, you have a lot of stress, a female doesn't sleep well, she's feeding her child, she is very tired, and she is bound to miss her drugs. So it is the support of her family and friends and the doctor that she takes her drugs on time and she doesn't get a fit.